So, good afternoon, everyone. I would like to welcome you all to a live session from Let's Update Language Academy for module. So, let's just wait a few minutes and then. So, I can see people joining in. So, yes, good afternoon, Priyamo, and good afternoon, Anjana M.A. Yes, good afternoon, Sini, John, and Meera Win. And hello, yes, to follows. Okay, so let's start the session. So let me introduce myself. I'm Pooja Kumar, and I'm here to give you an insight about OET reading module part B. So as you can see on the screen, so OET reading subtest that is consisting of three parts. Okay, that is part A, B, and C, and you will have a total of 42 questions, and you will have 20 questions from part A, 6 questions from part B, and 16 questions from part C. Okay, and regarding the time duration, you will have a total of 60 minutes to crack the test, and of which 15 minutes from will be allotted for part A, and 45 minutes will be allotted to part B and C together. Okay, and regarding OET reading module part B, what I need to tell you is that it assesses your ability to identify the purpose or main idea from a short text quickly. Okay, and the text may usually consist of emails, memos, guidelines, policy documents, circulars, notifications, announcements, manuals, or internal communication. So these are the kind of areas or categories from which you can expect the extracts from, or the questions. In part B section, and part B will consist of 6 short texts followed by 6 questions. Okay, so each text will be followed by one question. Okay, and that will be followed by three option multiple choice. Okay, so from which you need to choose one answer. And regarding how to approach part B. So that is, you need to read the heading to understand what the text is about. Okay, and then you need to read the question to know what information you need to find. Okay, and then read the content of the text and then read the answer options. Okay, so and then choose, decide and choose the most appropriate answer. Okay, so that is how you need to crack or approach part. Okay, so and regarding like how to find the answer. Okay, so you should be able to choose the answer easily if it is directly and specifically mentioned in the text. Okay, in the extract. Okay, if it's a direct answer, you should be able to choose it easily. But in case it's not directly mentioned and you are unable to find a direct answer because it may be indirectly specified, if that is the case, you can choose the elimination method. That means you need to find enough evidence to prove how the other options are incorrect or wrong. So, and then you can reach the answer like that. Okay, so that is the elimination method. So these are the commonly used approaches, okay, that you use to approach or crack part B section. Okay, so now we shall start with the discussion of part B module. I hope you can see this on the screen. Right. So now this is the text one, as you can see on the screen. So part B of this module. So this is text one. Okay, as you can see on the screen, this is the extract and it is followed by a question and three options. I hope this is visible to you. Okay, so how do you approach the text? So first you can read the heading, that is general guidelines for eye drop application. That is the heading. Okay, so you will get an idea what the extract is about, and then we approach the question. Read the question to know what you need to find. Okay, so the question is, what does the following article say about the application of eye drops? That is a question. Okay, so you need to read the text and understand what is written in the extract or the text. Okay, and then read the options and come to a conclusion and choose the most appropriate answer. Okay, so I'll give you a minute to read the extract now, okay, silently by yourself, and then we'll solve it together. So I can see a lot of you joining in. Yes, good afternoon, Siba, Justin, and hello, Roji Anish. Good afternoon, Tessa, John, and hello, Anne Matthew, and good afternoon, Sandra. Yes, hello, Mira Win. So please feel free to put in your choice of answers in the comment section in Facebook if you have completed reading and solving. Okay, so let's read it together now. So that is, the question was, what does the article say about the application of eye drops? And the extract is like, these guidelines give general advice on how to use most eye drops. However, you may be given specific instructions which may vary from the advice below. After thoroughly washing your hands, sit or stand in front of a mirror, bend your head backwards and gently pull your lower eyelid down. Hold the dropper above one eye, squeeze one drop into the pocket formed by gently pulling down the lower eyelid. Try not to touch your eye, eyelashes, or anything else with the dropper tip in order to keep it clean. Let go of the eyelid and keep the eye closed for as long as possible after application of the eye drop, with your head tilted down towards the floor. Wipe away any liquid that falls on your cheek with a tissue. So that was what the extract was about. So now coming to the options. Option A is there is more than one way to apply eye drops. Option B is the dropper tip should be wiped clean after each use. And option C is your eye should be closed for 2 to 3 minutes before applying eye drops. So what do you think is the answer? Please put in your choice of answers in the comment section in Facebook and I'll read out your answers. Yes, I want more of you to participate. Okay, so please put in your answers in the comment section. Okay, so I can see that some of you have put an A as a answer. So, yeah, Naveen Jacob Imbard has put an A as answer, and Meeravin has chosen A as answer. Seema Justin has chosen A as answer. So, the answer is indeed option A, that there is more than one way to apply eye drops. Okay, so I'll just highlight the answer portion so that you will get an idea. So option A is the answer, and why do you think it is A? Because in the very first part of the paragraph, they have mentioned that, however, you may be given specific instructions which may vary from the advice below. So they have given specific set of advice there. Okay, so but they have mentioned that there you may be given specific instructions which may vary from the advice below. That means there is some other kind of approach also, or some other kind of way also to apply eye drops. Okay, not just the instruction mentioned here. Okay, there is another set of instructions which may be given to you. Okay, and which may vary. Okay, so I am selecting that portion. Yeah, that is a sentence which will let you know, or come to this answer, which is option A. Okay, so now moving to text 2 or extract 2. And so the heading of extract 2 is cochlear implantation recommendation, and the question is, which of the following statement is not mentioned? Okay, so I'll just highlight that because this is a question in which they are asking you for something that is not mentioned. Okay, so that means two options are mentioned in the text, and you have to find the option which is not mentioned. Okay, that is our challenge here. So, okay, so and now I hope you can see the text as well as the options at the same time. So I'll give you a minute to read it by yourself, and then come to and choose an answer, and then we'll crack it together. Okay, so now let's read it together. So this technology appraisal examine the currently available devices for cochlear implantation. Unilateral implantation is recommended as an option for people with severe to profound deafness who do not receive adequate benefit from acoustic hearing aids. If different cochlear implants are considered to be equally appropriate, the least costly should be used. Assessment of cost should take into account acquisition costs, long-term reliability, and the support package offered. Simultaneous bilateral cochlear implantation is recommended as an option for children and for adults who are blind or who have other disabilities that increase their reliance on auditory stimuli as a primary sensory mechanism for spatial awareness. Patients should have severe to profound deafness with limited or no adequate benefit from acoustic hearing aids. Okay, so that was what the paragraph or the extract was about. Okay, so what do you think is the answer? Please put in your choice of answers in the comment section in Facebook. Let's look at the options. Option A is value for money is an important factor for cochlear implantation acquisition. B, both adults and children could be possible candidates for cochlear implantation. Option C, simultaneous bilateral cochlear implantation necessitates the use of identical devices. Okay, so yes, I can see your choice of answers here. So they are asking for something that is not mentioned. Okay, so you need to be careful about that. So Roji Anish and Meeravin has commented option A as answer. So just to remind you, they are asking for something that is not mentioned. Okay, so just see whether your choices of answers, whether that's mentioned or not. Okay, so let me tell you the answer. The answer is option C. Okay, so that is something that is not mentioned. Okay, so I'll just highlight the answer and then I'll tell you which sentence in the extract will lead you to this answer. Okay, because regarding the value for money, okay, so that is actually mentioned here. That means assessment of cost should take into account acquisition cost, long-term reliability, and the support package offered. So something about the cost and the value for money, okay, that is important and that is mentioned here. Okay, so that is mentioned here. Okay, so and regarding option B, which is both adults and children could be possible candidates. That is also mentioned here. That is, I'll highlight that information. That yeah. So this is recommended as an option for children and adults. Okay. So yes, that is also mentioned. So A and B is both mentioned. So we are left with C. So they have just mentioned about bilateral cochlear implantation, but they have not mentioned that it necessitates the use of identical device. Okay, is something that is not mentioned here, and that is why that is the answer. Okay, so I hope that is clear to you. So moving on to question number 3 and extract number 3, you can see the heading as Apple Watch detects irregular heartbeat in large US study. That is the heading, and the question is, what can you infer about Dr. Butt's opinion? Okay, so that is the question, and based on the question, so you need to find information. Okay, um, and you need to find the answer to this question. So I'll give you a minute to read it by yourself and then we'll solve it together. So now let's read the extract together. So that's Dr. Deepak Bhatt, one of the study's lead investigators, said the physician can use the information from the study, combine it with their assessment, and then guide clinical decisions around what to do with an alert. The study found that 57% of participants who received an alert on their watch sought medical attention. For Apple, the data provides firepower as it pushes into healthcare. Its new Series 4 watch has the ability to take an electrocardiogram to detect heart problems and required clearance from the US Food and Drug Administration. Dr. Butt called it an important study as use of this type of wearable technology is only going to become more prevalent. Okay, so and also just be careful about the heading. Just look at the heading. What is this about? Okay, it was about Apple Watch and it detecting irregular heartbeat in the US study. Okay, so now the question is, what can you infer about Dr. Butt's opinion? Is it A, he is doubtful that a proper diagnosis can be made? B, he thinks this type of technology is likely to become widespread? Or C, he is a proponent of the medical uses of wearable technology? Okay, so these are the options. So what do you think is the answer? Please put in your choice of answers in the comment box in Facebook. Okay, regarding option A, option A is he's doubtful that a proper diagnosis can be made. He's not doubtful there, right? In anywhere in the text, there is no mentioning of him being doubtful about the diagnosis that can be made. Okay, so you can eliminate A. Okay, and what about C? He is a proponent of the medical uses of wearable technology. Okay, so in option A, what is mentioned is what do you mean by the word proponent? Proponent means a person that advocates or a theory, okay, or supports a theory. Okay, so yes, he is a proponent, but of the medical uses of this wearable technology, which is Apple Watch. Okay, so they have specifically mentioned that he is a like he is advocating or supporting the use of this type of wearable technology, which is Apple Watch. Okay, so specifically that is mentioned. Okay, not the medical uses of any wearable technology. Okay, he's like specifically aligned to Apple Watch. Okay, so that is why, so you cannot take C. Okay, because C is about some any wearable technology. It could be anything because it's a general statement. Okay, so that is why we not take a C. We have to eliminate C as well, and we are left with B. Okay, see if B is correct. He thinks this type of technology is likely to become widespread. Okay, so that is definitely mentioned because in the last sentence, Dr. Butt called it an important study as use of this wearable technology, which is Apple Watch, only going to become more prevalent. Prevalent in the sense? Prevalent in the sense it's going to be widespread. The use is going to be widespread. Okay. I'll just highlight the information. But, see if it to locate the answer. Okay, so now we are moving to text 4 or extract 4 and the question. So I'll read the question in this article. What does the word advocate indicate? Okay, what does the word advocate indicate? And now this is the extract. The extract heading is violence in the workplace, growing problem. So now I'll give you a minute to read it by yourself and come up with your answers in the comment section on Facebook. Okay, so let's read it now. So, violence in the workplace, a growing problem. That's a heading, and the extract is workplace violence is in any form comes at a high cost to the individual and institutions. It has lasting effects on our healthcare system and deeply impacts clinicians on a personal and professional level. Workplace violence can have a wide ranging of impacts, including effects on self esteem, relationships with co workers, recruitment, and retention. The psychological trauma often makes individuals fearful of returning to work. As healthcare professionals, we must be advocates for not only our patients but also for ourselves. A safe working environment is built upon a foundation of trust and respect for all. No case should go unreported, and zero tolerance should be implemented to ensure that we can protect ourselves as well as deliver safe patient care. That was what the extract was about. So, and the question is in this article, what does the word advocates indicate? Okay, so and the options are A, sometimes workplace violence results in legal procedures. B, healthcare workers may need to support themselves as well as their patients. Option C, violent patients should be admonished. Okay, so these are the three options. So, so over here, what you can say is that option A, sometimes workplace violence results in legal procedures. Okay, that is something that is not mentioned. Yes, they are talking about workplace violence, but they have not mentioned that it may result in legal procedures also. Okay, it's not mentioned in the text, and because of which we have to eliminate A. Okay, and regarding option C, violent patients should be admonished. Okay, that is something that also not mentioned. Okay, so they are talking about violent behavior and violence in workplace, but they have not mentioned that these sort of patients should be admonished. Okay, so that is also not mentioned. And coming to option B, healthcare workers may need to support themselves as well as their patients. Okay, so that is something that is mentioned over there. That is, as healthcare professionals, I'll highlight that information. As healthcare professionals, we must be advocates for not only our patients but also for our, okay, advocate. The word advocate means to support. Okay, so because of which our answer will be B. Okay, okay. So now we are moving to text 5 or extract 5. So now the heading is it safe to re-infuse blood drawn from a CVAD via a syringe when checking line patency or drawing blood? And the question is, what does this article tell the reader about drawing blood? So I'll give you a minute to read it by yourself and come up with answers. Okay, so now let's read it. So, before withdrawing a blood aspirate from a central venous access device, that is CVAD, ask yourself, why am I taking this blood aspirate? Are you taking the blood aspirate to access for device patency prior to hooking up to an intravenous infusion, or do you require a blood sample for laboratory analysis? If you are simply checking CVAD patency, you only need to pull blood back into the catheter until you see the liquid gold. It never needs to come as far as the catheter hub and needleless connector. The ease of aspiration can still be assessed with the small aspiration technique, as you get a different feel when you are aspirating air. More resistance is felt as opposed to the free flowing feeling of aspirating. That was what the extract was about. And coming to the options, option A, the procedure of pulling blood back gives rise to more than one sensation. Option B, the catheter should be removed before taking blood samples. And option C, aspiration should be avoided in CVAD procedures. So these are the three options. So please put in your choice of answers in the comment section. What do you think is the answer? Okay, so okay, we are doing the elimination method for each question also. Okay, so that means I am giving you enough evidence to tell that the other options are incorrect as well. Okay, not just coming to the direct answer. So see, look at option B, the catheter should be removed before taking blood samples. Have they mentioned something like that? No, they have not mentioned that the catheter should be removed before taking the blood sample. Okay, so you need to eliminate option B and look at option C. The aspiration should be avoided in CVAD procedures. No, they have not mentioned that during CVAD procedures aspiration should be avoided. Okay, and so B and C is eliminated, which takes us to option A. Now see if option A is correct. The procedure of pulling blood back gives rise to more than one sensation. Is that mentioned? Yes, it is mentioned. So I'll just highlight that information, that is the ease of aspiration can still be assessed with the small aspiration technique, as you get a different feel when you're aspirating air. More resistance is felt as opposed to the free flowing feeling of aspirating liquid. Okay, so that means there are two types of feelings or sensations. One is of the free flowing feeling of aspirating liquid, and the other is when you are aspirating air, that means more resistances. So these are the two kinds of feelings or sensations that will be felt. Okay, and because of which the answer will be option A. The procedure for pulling blood back gives rise to more than one sensation of it. Okay, so I hope that is clear to you. So now we'll move to extract number 6. Okay, so that is, the heading is, what should I consider before participating in a clinical trial? So that is a question, and that is the heading, and the question is, what advice is given in this article about participating in a clinical trial? Okay, so that is a question. So I'll give you a minute to read the extract and come up with your choice of answers in the comment section of FB. Okay, so we shall read the extract now. So, now the question was, what advice is given in this article about participating in a clinical trial? Okay, so the extract goes like this. Before participating, you must be provided with an informed consent document explaining the risks and the potential benefits of the trial. Be sure to read over this information carefully. It is important to fully understand the purpose of the trial and what to expect. You will want to find out if the treatment will interact with any of your current medications or affect any other medical conditions you may have. You should be informed about what tests or procedures, such as biopsies or blood draws, will be performed, and you should consider your comfort level with what will be done. Also, think about whether you're prepared for any anticipated side effects, pain, or discomfort that may be involved. So, that was what the extract was about. And coming to the options, they were asking about the advice given in this article. Okay, about participating in the clinical trial, and the option A is you should inform a family member of your intentions. Option B, you should give consent to possible side effects. And option C, you should know about the reason for the trial. Okay, so here, if you check option A, you should inform a family member of your intention. Okay, so that is some information that is completely not mentioned in this extract. Okay, so no information is provided regarding that you need to inform a family member of your intentions. Okay, so we need to directly eliminate option A. Moving to option B, you should give consent to possible side effects. Okay, so that means regarding side effects, they have mentioned something. Okay, that is, you will want to find out if the treatment will interact with any of the current medications or affect any other medical conditions you may have. That means you are um, you are wanting to know the side effects, but they have not mentioned that you need to give consent to possible side effects. Okay, that is not mentioned here. They have just mentioned that you need to find out whether there could be possible side effects, or whether it will affect any other medical conditions you may have, or whether it will interact with any of your current medications. That is only mentioned, not about consent. Okay, so you need to eliminate option B as well, and which leaves us with option C. So check if option C is correct or not. Option C goes like this: you should know about the reason for the trial. Is that mentioned? It is mentioned. That is okay over here. Okay, so it is important to fully understand the purpose of the trial, what to expect. Okay, the purpose of the trial, that means the reason for the trial, and what. So that is mentioned here, and because of which your answer should be okay. So I have highlighted the answer as well. So hope you have understood whatever we have discussed. Okay, so and I hope you have got an idea how to approach part B. Okay, so we are winding up this session. So thank you for joining us. See you next week. Take care.